Blood pressure, or BP, is the pressure exerted by the flow of blood on the walls of the arteries. It is determined by the force and amount of blood pumped by the heart and by the diameter of the arteries. It consists of two components, systolic pressure and diastolic pressure. These are normally 120 and 80 milligrams of mercury, respectively. When the blood pressure exceeds these values, it leads to a condition called high blood pressure, or hypertension. There are two types of hypertension, primary and secondary hypertension. Primary hypertension is hypertension without a specific identifiable cause. Secondary hypertension is elevated blood pressure that results from an underlying, identifiable, often correctable cause. Only about 5 to 10% of hypertension cases are thought to result from secondary causes. The most common causes of secondary hypertension are kidney disease, adrenal gland disease, narrowing of the aorta, and sleep apnea. Hypertension frequently causes few or no symptoms. Therefore, regular blood pressure checks should be done to diagnose hypertension. When symptoms occur, the most common symptoms are headaches, dizziness, and blurred vision. In severe cases, confusion and coma are possible. Blood pressure is usually measured with a small portable instrument called a blood pressure cuff, or the sphygmomanometer. The blood pressure cuff consists of an air pump, pressure gauge, and rubber cuff. The instrument measures the blood pressure in units called millimeters of mercury, or mmHg. A blood pressure reading of 120 over 80 milligrams of mercury is considered normal, whereas a blood pressure of 140 over 90 milligrams of mercury or higher is considered high blood pressure or hypertension. Hypertension can be managed by changes in lifestyle, such as by quitting smoking, eating a diet lower in cholesterol and salt, getting regular exercise, and by taking antihypertensive drugs, such as beta blockers or other antihypertensive medications.
The heart pumps blood full of dissolved oxygen to the body through the arteries. Arteries are not simply tubes, but have elastic walls made of a special type of muscle. The muscle can constrict or dilate, making the arteries narrower or wider.
Damage to the inner wall of the artery causes fatty substances in the bloodstream to stick to it, forming plaques that make it stiffer and narrower in the process, called atherosclerosis.
The kidneys play a part in controlling blood pressure by removing water from the bloodstream and excreting it in urine. They control the body's total volume of blood and thus the blood pressure.
Renin-angiotensin-aldosterone system, or RAS, or RAAS, plays an important role in maintaining a normal blood pressure. It controls the blood volume, blood pressure within the blood vessels, and functioning of the heart. Renin is an enzyme primarily released by the juxtaglomerular cells of the kidneys and also found in other tissues of the body. These enzymes are activated by the prostaglandins released by macula densa. Closely packed cells found in kidney, macula densa, are sensitive to change in levels of sodium chloride, NaCl, in the fluid that passed through them. Renin is released in response to sympathetic stimulation, fall in blood pressure within the renal arteries, and depletion of sodium levels in the distal tubules. The released renin acts on angiotensinogen, a glycoprotein synthesized by the liver. Renin cleaves the angiotensinogen to form angiotensin 1. Angiotensin 1 is converted to angiotensin 2 by angiotensin converting enzyme, or ACE, found in the capillaries of the lungs. ACE also inactivates bradykinin and other vasoactive peptides. Other than ACE, enzymes like cathepsin G, elastase, tissue plasminogen activator, chymostatin sensitive AT2 generating enzyme, and chymase can also convert angiotensin 1 to angiotensin 2.
Discover more at Focus App Store, the simple way to explore science and medicine.
Hypertension is increasing in frequency in children, unfortunately. It has to do with changes in the obesity rates in the overall population. And so pediatricians have really increased their surveillance of high blood pressure and are finding it more frequently. If you have children, you should ask the pediatrician about the frequency of checking blood pressure, and often blood pressure will first be checked at perhaps the first toddler visit, 18 or 2 years, or perhaps a little bit later if there are no risk factors. Now, it's not that we would put every child with high blood pressure on medication, and in fact that would be very uncommon, but by identifying this risk and instituting lifestyle changes, dietary modification early, we can treat. So talk to your pediatrician about what your child's blood pressure is and make sure that it's in the normal range, and what you might do to help keep their blood pressure normal. One exception might be that in that child who has very high blood pressure that's difficult to control, and that would be when we would look for abnormalities in a kidney artery, kidney dysfunction, or other problems. So there would be that uncommon child that would have perhaps treatable cause or underlying cause. But the vast majority of hypertension we are seeing in children these days is essential hypertension, just like what we see in adults.